Today we're going to learn about physical therapy, rehabilitation, and alternative medical nursing. This is chapter 24 in your McCurnin's textbook. Learning objectives for this chapter are to understand all of the key terms, to be able to pronounce them and spell them as well. Nutraceuticals and Chondroprotectants, what are they and why do we use them? Western herbs, Chinese herbs, and Ayurvedic herbs, what are they? What are the differences between them and where did they come from? Why do we use them? Acupuncture and chiropractic manipulation or spinal manipulation. How do we use them in veterinary medicine? And also physical therapy in veterinary medicine or veterinary rehabilitation. Complementary and alternative therapy is a more natural approach. It's holistic, meaning it treats the whole animal. And to be honest, with veterinary medicine, I believe veterinarians are much more in tune with treating the entire animal. When we're looking at an animal during a physical exam or during the treatment process, we realize that they're not telling us the whole story, and we have to look at everything in order to understand what's going on. It's an ongoing and dynamic process, meaning that we have to evaluate, reevaluate, and change things as we need to, as we see them. And there's a variability in the state of health of animals. They don't just come in sick or healthy. There is a little bit of sick, a lot of sick, and a lot of stages in between. Rehabilitation has to do a lot with pain relief to make sure that we get function back. So using acupuncture, chiropractic treatments, and physical therapy is part of the stuff that we talk about. Nutraceuticals and chondroprotectants. These are becoming more mainstream. Nutraceuticals are nutritional supplements. They're not herbs. They're not approved as drugs, but they're thought to convey therapeutic benefits. So they're food sources that are used for therapy. They're used to treat a lot of different conditions. They can assist in maintaining general health and well-being, just like if you eat well, you feel well. Glucosamine and chondroitin sulfate are chondroprotectants. What does this mean? Chondro means cartilage. To protect the cartilage means we're protecting cartilage within the system, but primarily within the joints. Omega-3 fatty acids are also chondroprotectants. Omega-3 fatty acids are very good at protecting a lot of cells in the body, though, so they are good for neurologic health as well as joint health. Polysulfated glycosaminoglycans, these are PSGAGs. They're also a part of the building block of cartilage, and so if you have more available to your body, you're able to use them to help protect your joints. Hyaluronic acid is another building block within joints, within cartilage. And so unless our glucosamine and chondroitin sulfate has omega-3 fatty acids and PSGAGs or polysulfated glycosaminoglycans and or hyaluronic acid, they don't tend to work as well. So we do want to see if we're giving a supplement that has glucosamine and chondroitin sulfate, we want to see one of these other things added to it as well. Within herbal medicine, we're talking about herbs or plant materials, and this is the most ancient known medicine. It's the foundation of modern medicine. It's less toxic than drugs. We do have to be very careful, though, that we don't use it carelessly. We need to remember that these early forms of medicine are what we started with. And so there is a way to be toxic with it, so we can't be careless about it. We also don't have a lot of testing on the amount that is proven safe for pregnancy or for various animals as well. A lot of these plants are actually toxic to cats. So we do want to be really cautious about the source that we're getting our herbal medicine from. To remember that these herbal medicines are not they're not being overseen by the FDA. And so there's no governmental agency necessarily that is looking at what is in that bottle of herbal medicine that you get from the health food store to tell you that there's the exact amount of milligram strength that they say that is in that each pill. So we do want to be very careful when we're getting herbal medicine or using it. Traditional Chinese medicine actually started before Western herbal medicine, thousands of years before Western herbal medicine. With traditional Chinese medicine, it's a little bit more regulated, and in order to practice this, you do need to have a certification. A diagnosis is needed, and it's actually performed by using herbal medicine, but in order to then use doses which are therapeutic, um, a diagnosis is required. There are certain formulas that are developed within the herbal medicine for different functions, or they have main ingredients, and these formulations are a combination of several different products. A practitioner of Chinese herbal medicine should have formal training, actually must have formal training to be certified, and it's a fair amount and a pretty good commitment to the training. It's a lot of memorization of what herbs go with what herbs and what system that they treat and what disease that they treat. We want to make sure the herbs come from a reputable source, for instance, an organic source. And we want to make sure that if we are using animal products, that we are doing it appropriately. Western herbs, when we talk about Western herbs, often we think of the snake oil salesman in the corner here, the picture of this started a long time ago, and because it's not regulated, these Western herbs are not regulated, we do associate it with maybe it doesn't have all the things in it that it should have, or maybe it has some extra stuff in it that it should not have. So we do need to be very careful with that. They do come in different forms. So there's bulk herbs, so you just buy a big tub of sage, for instance. Capsules and tablets, so these things can be put into capsules and tablets. We can drink them in teas, extracts, poultices, and compresses, so using transdermally or topically, ointments, and essential oils. Those are all considered Western herbs. Any proprietary blends, these are things that people have kind of put together and say, hey, this works for everything. We do want to be careful with. Using herbals and medications that have the same effect. So there are a lot of different plants that can have the same effect. It's kind of like if you take naproxen and ibuprofen at the same time. They're both non-steroidal anti-inflammatories. And if you take too much of one thing, even too much of a good thing can be a bad thing. Western herbs generally are used to support general health, so they need to be, it's called tonification, so they need to be taken over a long period of time. We can use it for detoxification, which means that when we take it, it binds toxins and removes them from our body. Administration is best done on an empty stomach with a small amount of water. Sometimes for animals, we might use a little salt-free broth. So if you see those cans of chicken broth that say no salt or low salt, that's what we want to use. Or juice. So if it's an animal that prefers sweet things like a bird or a rodent, we might give them juice and a small amount of juice with a Western herb. Ayurvedic herbs. Ayurvedic means the science of life. These herbs or this use of these herbs originated in India, and these include herbal prescriptions, diet, massage, exercise, and meditation. So it's not just the herbs themselves, but it's using the herbs in combination with some lifestyle things to help with healing. There can be a formulation of multiple ingredients. The herbs that we see being used in Ayurvedic medicine would be herbs like Thai basil, cilantro, turmeric, things that you would associate with Indian cooking or East Asian cooking. Acupuncture is the technique of piercing skin with a needle at specific predetermined points. Now, these points have been predetermined for thousands of years. Has been a lot of research going into these specific points that are helpful with therapy. It is a medical method that is used within traditional Chinese medicine. It's most often used with pain management, If we are using it with animals, it has to be done by a licensed veterinarian that has been certified in acupuncture. There are a couple of acupressure points that we know as veterinarians that we can use, but when we're actually using acupuncture for therapy through the whole body, we need to be certified in it. There are charts that are available for dogs, cats, cows, horses, etc. And these are called meridian charts, and they pinpoint very specifically and anatomically what points are associated with different systems. And using these points in a very specific pattern will help to alleviate pain or to open up uh, blood vessels to improve overall health. We know that anatomically these meridians or channels actually do exist. They are pathways that connect the acupuncture points. They are associated, there are 14 classical meridians, and there are 12 that are associated with specific organ systems, and there are 2 that run with the midlines of the body. On the back and on the ventrum or the chest and abdomen. Using these in a specific pattern can help to relieve various systems, etc. There are a number of different theories about why acupuncture works. As I said, there's been a lot of research that goes into acupuncture. Um, Basically, we know that energy circulates through these meridians every 24 hours because energy circulates through your body every 24 hours. We know this by taking blood, measuring electrolytes, measuring blood cells, etc., etc. So there's a lot of science behind this. What the thought is that the blockage of this energy as it circulates through the body, if it's blocked at any point, that's where we're starting to see dysfunction or disease. It can be stagnant energy, which is associated with painful spasms or swelling. It can be deficient energy, atrophy or weakness. Atrophy means the loss of muscle tone or muscle mass. It can be stimulating or it can be sedating energy at different acupuncture points. And if we can stimulate the different acupuncture point or sedate it, that helps us to bring the body back into balance. The 5 different theories are the gate theory, the endogenous opioid theory, the autonomic nervous system input theory, and the the humoral theory and the bioelectric theory. The gate theory has to do with thinking that the acupuncture, when you put a needle into the point, that it actually opens a gate and allows energy to move through it. I think it's a little bit more complicated than that, and it probably has a lot to do with these other 4 things. Endogenous opioid theory is when we stick a needle into a acupressure point that it releases these endogenous opioids, which is it's basically endorphins, and it makes that area feel good and then brings the body back into balance. The autonomic nervous system input theory has to do with, so autonomic means automatic, so your involuntary system, which keeps everything in balance in your body, and stimulating different acupressure points are stimulating nerves, and so it's the theory that if we're stimulating nerves in the right way, then we are creating a better balance in the body. The humoral theory is really interesting. It has to do with hormones and blood, things going through the bloodstream, and creating differences in that by placing acupuncture needles. What's really cool about this is part of the research was that an animal was being treated with acupuncture, and the blood was taken from that animal after treatment, and an animal with a similar disease or pain was given an injection of or a transfusion with that blood, and they found that animal that did not have acupuncture had the same effect on that animal, pain relief on that animal, as it did with the animal that had acupuncture. So the acupuncture is actually physically causing changes in the blood that can then affect another animal. And then there's the bioelectric theory, which has to do with, again, kind of a nervous system thing and trying to put all of um, the cells that talk to each other through electrical stimulation, put them back into balance. So I really think that, the gate theory is, it tells us a physical thing, things open up and close. Um, but the other four really kind of bring everything together, looking at the nervous system, looking at the cascade of hormones, etc., through the endocrine system, and seeing how that actually changes what's going through the bloodstream and causing changes within the electricity of the body. Whatever the theory, it does seem to work. Dry needling is very similar to acupuncture. Well, it is acupuncture. Dry needling is a little bit different because it has more to do with placing needles and stimulating within the muscle and not specifically necessarily the acupressure points. Often with acupuncture, we'll use stainless steel acupuncture needles. They are sterile. Occasionally we'll use gold because it's thought that gold has better conductivity within the body. Moxibustion is when we use steam or um, burning of different materials underneath a glass, using those kind of a suction thing to create a bigger area of uh, blood flow around the acupressure points. Burning of dried leaves or of Artemisia vulgaris, or the mugwort plant, at the acupressure points is thought to, again, increase the blood flow through that area. Aquapuncture is when we actually inject solution into an acupuncture point. Electroacupuncture is when we take those needles and pass electrical energy through the acupuncture points. We can actually get a longer action of the acupuncture if we implant surgical materials to achieve a continuous stimulation. And some of those surgical materials that we might implant would be catgut, which is a suture, common suture, stainless steel, silver, gold is most common, and that's considered to be a surgical procedure because it must be done sterilely. Here's a picture of an animal getting some fluid into an acupressure point. And this acupressure point actually has a calming effect, and the fluid will stay there for a period of time, not a long time, but a period of change in this animal, at least for about an hour or so. We can also use a cold laser. We'll talk about what cold lasers are in a minute, but we can use those to stimulate acupuncture point. We can just use pressure to stimulate an acupuncture point, just by physical pressure. When we do place needles, we can actually use a hypodermic needle, one that you would put at the end of a syringe. We can actually use that in different places as well. We just need to remove it after a period of time. So why would we use acupuncture? Well, pain and lameness, which could be due to musculoskeletal disorders or neurologic disorders. There has been an interesting study with intervertebral disc disease, or IVDD, where a disc has slipped and is pressing on the spinal cord. It is 90% effective with acupuncture versus 70. If you do surgery, that's 76% effective. If the animal still has deep pain, which means it still has the passage of information from the brain through the spinal cord to the extremities. So as long as we have somewhat of a connection in the spinal cord, then acupuncture is 14% more effective than surgery for those neurologic disorders. So that's pretty cool. We can use it for skin disorders or dermatologic disorders, behavioral disorders, reproductive disorders, gastrointestinal disorders, and just to improve the quality of life. It can be highly effective. Veterinary spinal manipulative therapy or chiropractic therapy manually restores reduced motion in spine and limbs. So it realigns things back in a way that it should be in the animal. It does need to be performed by a trained professional. A veterinarian needs to be trained in chiropractic techniques, and a chiropractor has to be trained in veterinary techniques, so you need to be certified. It's typically adjusting vertebrae. So what we're trying to do is if there's a subluxation or vertebral subluxation, which means it's not completely out of joint, but it's a little bit out of joint. There's an abnormal relationship between two adjacent vertebrae. We're just popping them slightly back into alignment, so it's a little bit straighter for that spinal cord. Signs of subluxation include pain and the lack of ability to ambulate. Causes of subluxation can be anything from muscle damage to the spinal cord damage. And then clinical signs will vary. It can be with a horse, it can be an animal that doesn't like to have its saddle put on. It can be digestive issues caused by some pinching of the spinal nerves. It can be a lameness. So there are a lot of different signs of subluxation. Um, Generally, for a chiropractor, technician, the goal is their role is to restrain animals. So if it's canine, feline, horses, cattle, to prepare chemical restraint if that's needed, to stabilize nearby segments. So you may be using all your weight on a vertebrae on a horse while your chiropractor is adjusting the other vertebrae, and then recording all the information. Your job is to, after treatment, to massage the patient, maybe apply essential oils, which is Western or Eastern herbal medicine, walk the patient, kind of loosen up the muscles and kind of get everything settled back into place, and then also to communicate with the client. For physical therapy and rehabilitation, basically what we're trying to do is relieve pain and restore mobility and function. It is a team effort. It's a team effort between the veterinarian, the physical therapist, and the technician and the client. Training and certification programs are available. You do need to be a registered veterinary technician, so you need to go through a program, and then you need to practice in a clinic for at least 3 years before you can take the classes. There are two different therapy programs available in the United States. One is through the University of Tennessee, and the other is through Canine Rehabilitative Services in Florida. Um, that is something that we as a program can help you find if you're interested after you graduate. Patient evaluation is the first thing, so we get a history, get a general physical exam, and then do a specific orthopedic and neurologic examination. Then the therapist, that's the physical therapist who is certified in this type of medicine, will devise a specific therapy plan for that patient. It is exercise-based therapy. The level of intensity and duration is based on the patient's strength and pain level. We have to be very conservative as we start out so that we don't get any setbacks. Think about when you start exercising after a period off, or you start exercising for the first time. If you go out and you work really hard because you're really into it, and then you're so sore the next day that you really don't want to go back, that's what we're trying to avoid. We want to start slowly, build up slowly so that they are strengthening those muscle groups in a way that is not too painful. We want them to be able to come back and do it again. So when we do strengthening exercises, they're very specific, and the physical therapist has been trained to do specific ones so that it targets specific muscle groups. We also do proprioceptive exercises. It's to help the patient develop better body awareness. If you don't walk on a balance beam every single day, then it is difficult for you to do that if you haven't done it for a while. And the more you do it, the better you are at balancing. And so what we do is we have different exercises that helps the animal be better aware of their body and how to balance their body. Okay, and that has to do with balance exercises as well, just to improve overall stability. There are also endurance exercises to emphasize the cardiovascular system, neuromuscular re-education exercises to help with posture and to correct gaits. The exercise plan is developed by the veterinarian or physical therapist, and then the rehabilitation technician is going to be performing the exercise and teaching the clients how to do the exercise. So here's an example of a dog on a treadmill, may have an orthopedic condition or a neurologic condition and needs to work on its muscle strength. And the easiest way to do this is in water. It's gentler on the joints, and it helps them to work their muscles a little bit harder in an environment that's not too difficult. So there's a lot of stuff that goes into this. We have to teach the animal to walk on a treadmill. We have to have them be comfortable in the water. It's nice warm water. We need to make sure that they're okay walking on the treadmill underwater as well. A land treadmill can be used as well for strength and endurance. It also gets their mind really focused, so it helps them to focus mentally as well. It's used for re-education, front to back balance, and normal foot placement. If we can make the treadmill go uphill or downhill, it actually maximizes that effect. So your role in that is to teach the patient how to use a treadmill, to monitor the patient, and to record the time, speed, angle, and progress as they move through the exercises. Massage, you can be certified as in horse massage, equine massage, and I believe they have a certification for canine massage as well. It's a systematic and scientific manipulation of the soft tissues, and you do need to understand the anatomy of the muscles in order to do this properly. So there are certification courses. There are a couple of different massage techniques that we'll talk about. There's shiatsu massage, which is finger pressure on specific points in the body, and it can be a little bit rougher. It's a little bit more um, deep palpation. So it does help to increase circulation and stimulate nervous system, but you do have to be trained in it to make sure you're not hurting any muscle. There's trigger point massage called myotherapy or muscle therapy. It's where we find taut bands or knots and use ischemic compression to relieve. What does that mean? Well, if we were in class, I'd be able to show you. But basically, what you do is you find a knot in the muscle and you push as hard as you can, or at least hard enough that it causes a little bit of a flinch maybe, to stop the blood flow to that muscle just for a few seconds. And then you're going to release it really quickly. And as you release it, the muscle or the blood vessels will open up back up in a hurry, and blood will just flow and flood that muscle. It will heat that muscle up and cause it to relax. So ischemic means to cut the blood flow off, and we're doing it with compression, and then we relieve it very quick or let it up very quickly, and the blood flows in very quickly. Sports massage is used as event massage or maintenance massage. So before or after an event, using massage to keep the blood flow going through the muscles to help heal the muscles. T-team or Tellington touch massage, it teaches a physical awareness of the body. It just manipulates the skin. So it's not a very deep massage at all. It's just touching the skin. It has a lot to do with the acupressure points as well. Swedish massage is actually the most common type used. It's when we're using our hands to go along the length of the muscle in a not a very deep way, kind of a soothing way, and it just increases the blood flow through the muscle. So there are massage techniques that are used in each of these different types of massage. Effleurage uses gliding strokes that follows the contour of the body. There's petrissage, which is kind of a kneading. There's rhythmic lifting of the muscles. There's a squeeze and release. There's friction, manipulation of the tissue or the not it's connective tissue more than muscle tissue, but all of these increase circulation. Tapotment is a tapping motion that is used in different things. You may have seen these videos on Facebook or on social media where kids are tapping their foreheads. It's actually a calming technique. Um, Coupage is a form of tapotment which loosens phlegm in the chest. And so what we do is we cup our hands on either the side of the chest and we bang on the side of the chest to loosen up the phlegm and allow that animal to cough it out. We use that with if we have a disease that creates mucus buildup in the thorax or in the lungs. So coupage is used pretty often. Vibration is a method that's been around for about 20 years or so. This is a vibrating plate that you see the horse on and the owner on. It's a rapid shaking or slower rocking at different frequencies are used, where it just kind of vibrates the whole body at a certain frequency. And the thought is that it increases blood flow and better cell communication. When you are thinking about doing Swedish massage, which you can certainly do with your own pet, it starts with intention. So you go into a massage with the intention of increasing blood flow and being relaxed and having a good idea of what you're trying to relieve. So intention is actually in your own head, not the pet's head, but your own head, what are you going to do? Then we have touch. Now, how deep, how much pressure, and how deep do you want to go? How far or how what's the excursion? How far you want to go with each stroke? The speed, so whether it's fast or slow. Um, it's important to keep a very constant rhythm and to continue. Have a continuity where you have a hand on the pet at all times. When you take your hand off of a pet and then put it back on, it can be very disturbing to the pet. And then how long are we going to do the massage, and what sequence are we going to do it? So we're going to start from the head to the tail, go to the tail, or we're going to start, with the feet and go up. So we want to have that in mind as we get started and do it the same way every time. And again, keep your hand on the pet throughout the massage so there's no break in touch. Times when we wouldn't, I would say there's no contraindications to massage, but there are. If you have a bacterial or a virally or fungally infected lesion, so you don't want to touch it and spread it through the body, any open wound, if you have a really bad acute, which is an injury that has just happened, or there's an inflammatory condition, any area of hemorrhage or bleeding, and any recent fever, these are times when we don't want to increase blood flow to that area or touch that area. Another physical therapy thing that we do quite frequently, usually after an injury or surgery, is passive range of motion. So our goal with passive range of motion is basically we want to stretch a joint and move a joint. We want to preserve that normal range of motion or return to a normal range of motion if it's absent. Every time you move a joint, you increase the cartilage nutrition in the joint. That's how the joint gets nutrition, by movement. It actually stimulates cartilage regeneration when you're moving a joint. So a joint that remains still gets stiff and it breaks down over time. There are rules of passive range of motion. The first rule is that we want to stabilize the joints so that we're just doing one joint at a time. So in this case, this person is stiffening up the elbow so that the elbow is not moving. So the hand is behind the elbow, and they are putting their hand at the top of the shoulder, and they want to just above the shoulder at the clavicle. So they just want to move that shoulder joint. So one joint at a time. Um, and we want to go slow. So we want to move just to the edge where it's a little stiff and then come back, and just to the edge where it's a little stiff. And the more often we do it, the less stiff it will become. So we would do it for a few minutes, a couple times a day. A couple other parts of therapy that we have are electrical and magnetic based therapy. So changing the frequency, the pulse duration, the intensity, the duty cycle, the ramp, and the treatment time are all things that the technician will need to learn how to do in order to treat different injuries. So this is a bulldog being treated for an injury in the upper arm with some electrical stimulation. So it's just stimulating that muscle to move. Moving that muscle will increase blood flow to the area. So this is neuromuscular electrical stimulation, or NMES. It strengthens the muscle because it's contracting the muscle. Um, if we can contract the muscle more frequently and strengthen the muscle in a muscle that is atrophied, it can really help that animal to stabilize joints around that muscle and keep that leg healthy. So your role in doing this is often we have to have little to no hair where we apply the pads. We want to make sure the skin is clean. You sometimes have to use gel in order to get good conduction of the electricity. Make sure that the patient is remaining calm throughout the session and record each session in the medical record. Bioelectric stimulation has to do with a transcutaneous electrical nerve stimulation, or a TENS unit, often used for pain relief. But we have to realize that the pain does return quickly after we turn it off. So it's very short time of pain relief. So this is very similar to neuromuscular uh, electrical stimulation, but it's transcutaneous, so it doesn't reach as deeply. Magnetic stimulation is when we use therapeutic magnets that have a certain strength, and these will change the electromagnetic charge of the cell and kind of flip it. And so when we flip that, it can increase the electrical activity between cells and help the cells to communicate a little bit better. One of the most effective things I think I've seen in physical therapy is this cold laser. It's called a cold laser because it's not hot, it's not creating heat, and it's not cutting the skin. So it's a low level laser therapy, or cold laser. We're going to use it in a lot of different uh, for a lot of different indications. So inflammation, a fracture, cartilage tear, pain, those kind of things are things that we use it for. Things that we do not want to use it for would be any infections, or if there's a cellular growth like a cancer, because it will increase cell growth, and so it will make cancers worse, also make infections worse. There are a couple different classes of, we call them classes of lasers. The ones that are used therapeutically are class 3A and class 3B and class 4. Now you'll notice that all of these say that they're dangerous to the eye. So retinal damage, if you point the laser, which you cannot see this laser, so it's easy to make a mistake and point it toward your eyes. You can actually cause retinal damage and go blind. So it's really important that you do have special glasses that are available. The class 4 laser is the one I see most often used in veterinary clinics. It is more dangerous than a class 3, and the reason you see it in clinics is that they've developed a machine that kind of does it for you. So you set up the machine with the size of the animal and what you're treating, and it does the work for you, and just hold it there until it says it's done. This is a class 3 laser. It's something that I actually have at home because I can use it on my own animals and use it really effectively. I've seen it do some amazing things. I control how deep that laser penetrates by the amount of time that I hold it on the limb. So there's a little bit more art involved in this class 3 laser. The reason that they're called class 3A, class 3B, class 4 is the amount of milliwatts that are expressed um, uh, in the output. So the milliwatts per output And so the greater than 500 milliwatts per output it's going to be a very strong laser. And the class 3B, you can actually adjust how much you're putting out there. So the other thing that we can use in a similar way is therapeutic. And the reason that I'm sorry, I should go back to the reason that the laser and the ultrasound work is what it's doing is with a laser, it's shooting light at a specific frequency and amplitude, and with the ultrasound, it's shooting sound waves at a specific frequency and amplitude. And if you can get the cells to vibrate at that specific frequency and amplitude, we found that to be very healing to the tissue. So again, the therapeutic ultrasound is used in a very similar way. Something else that is used maybe not as often because it can be uncomfortable is an extracorporeal shockwave, which is using a high energy focused sound wave to deliver energy at a very specific focal point in the body. But the patient does need to be sedated for this, and it's a very can be very uncomfortable and loud sound. Something often forgotten when we're doing therapy is cryotherapy. Cryotherapy is ice bags. Just an ice on an animal it can be very helpful with inflammation. So vasoconstriction, you can use a Dixie cup that's 3/4 full of water and then frozen. Commercial cool packs. Frozen peas are great because it's flexible. It will form around a wound or around a body part. Alcohol in water and water in a Ziploc freezer bag is something that it doesn't freeze like an ice block. It freezes with a little bit more flexibility. Using machines that pump cold water, ice cold water, through some hoses that are encapsulated, and you can wrap around an animal. Um, Running a cold hose over an injury, so just taking cold water in large animals and running it over an injury. Or for equine extremities, there are therapeutic ice boots as well. Warm heat or wet warm heat is the recommended method if we need to use warm heat in an area to bring um, blood flow to that area to help heal that area. We can use a hand towel for small areas or a bath towel. Generally, what I'll do is get a bowl of really hot water, put the hand towel or the bath towel in it, wring it out, put it on the area, apply the heat. As soon as that towel gets cool, put it back in the hot water, wring it out, or get a new one and put it on there. If the animal does not have sensory sensation, we do not want to use cold or hot heat therapy because we don't want to burn the skin, and they will let us know if we're damaging the skin. Harnesses or slings are used if we need if they we expect them to have full independence shortly. So if it's not a long-term solution because it does take a lot for the human to still have to lift up their pet. It allows the client to help assist the dogs. Oftentimes we just use a rolled towel underneath their legs to help walk them. For larger animals, you'll see a big harness and sling system attached to a ceiling beam. It's even more important for large animals to get them up off of their legs because the longer that they stay down, the less likely they are to be able to use their legs again. We do have protective devices. There are nail caps that protect nails from wear or to protect sharp nails as well, or protect your furniture as well. Boots can protect the entire paw. We may have to put some elastic bands around them to keep them attached, but we have to be very careful not to cut off circulation. Some assistive devices that we might use in animals would be braces and wraps. We will talk about, yeah, in a few weeks we'll be talking about bandaging. Just provide some light to moderate support and it can be helpful with limb alignment if we have like a luxation of a joint or a fracture. A custom orthotic is like this kind of walking boot here, provides rigid support or support in the joint that is not commonly braced. It limits the range of motion of that joint, so it helps to kind of stiffen that joint up if that joint's a little bit lax. Prosthetics is a replacement of a limb. that's missing. So this is an example of a dog with two prosthetics of the front limbs. It's replacing the feet of that dog. Wheelchairs allow the patient some freedom of movement, allow some regular exercise for the parts that are working. We want to introduce them for short periods to start and make sure they're properly fitted so you don't get chafing or wearing of the body underneath here. That's it for our alternative medicine, pretty cool part of veterinary medicine. Highly recommend you look into some of the certification programs that you can get into.